We'll now proceed for further amendments. Mr. Pallone, do you have, Mr. Pallone, you have an amendment. I want to ask you, is it an amendment to Division C? And was the amendment submitted with 2 hours lead time for committee review? And are there copies for distribution at the desk?
Yes.
Okay. Let's have the amendment distributed, and the clerk will report the amendment.
Amendment to the amendment in the nature of a substitute to H.R. 3200 offered by Mr. Pallone, New Jersey. On page 968, beginning at line 19, strike, quote, or other population or subpopulation.
Without objection, the amendment will be
reserved in point of order.
Gentleman's recognized for his reservation.
Just reserve a point of order, that's all, Mr. Chairman.
Gentleman from Texas reserves a point of order. Without objection, the amendment will be considered as read, and the chair recognizes Mr. Pallone for 5 minutes.
Thank you, Mr. Chairman. I'm referencing this as the omnibus amendment to the public health title. Omnibus, not ominous, omnibus.
I think ominous is the better term.
No, I think actually you'll like this for the most part. This amendment reflects the hard work of many members on this committee, and I'd like to thank you all for your dedication to these very important issues. First, the amendment includes the Class Act, a bill that I originally introduced with my colleague, Chairman Emeritus Dingell. These provisions establish a national voluntary insurance program that will, among other things, allow individuals with functional limitations to maintain their personal and financial independence, and it will alleviate burdens on family caregivers. Now, members have asked us to include provisions on long-term care in the bill, and I believe that these provisions will get at the heart of some of the challenges that we face in the long-term care sector. Next, referencing health centers liability coverage, we have included language that Mr. Green and Mr. Murphy have been working on to extend Federal Tort Claims Act coverage to medically licensed volunteers who practice at federally funded health centers. This is something that we talked about at some of the hearings. Community health centers are vitally important in providing care in underserved areas. Physicians, however, are often dissuaded from volunteering their services at these health centers due to the cost of medical liability insurance. By extending the FTCA coverage to volunteer physicians practicing at federally qualified health centers, we can increase the number of physicians serving in underserved communities. The next provision in the omnibus refers to nurse-managed health centers. To further increase access to health care in underserved communities, we've included language proposed by Ms. Capps that would establish a nurse-managed health center program within the Health Resources and Services Administration. Similar to community health centers, this program would provide grants to entities to plan, develop, and operate nurse-managed health centers in communities where there is a lack of access to medical care. Next, we address federally qualified behavioral health centers. In the omnibus, we have included a new definition of federally qualified behavioral health centers put forth by Ms. Matsui and Mr. Engel that will allow the centers to provide a basic set of mental and behavioral health services to underserved communities and will help ensure adequate capacity to serve patients with mental health needs. Next is the reauthorization of telehealth and telemedicine. The omnibus includes language spearheaded by Mr. Butterfield and Mr. Space to reauthorize the Telehealth Network and Telehealth Resource Center grant programs. These programs are aimed at reaching underserved and remote areas by establishing linkages between hospitals, providers, and patients in rural areas. Next is with regard to trauma care. We included Ms. Castor, Mr. Towns, and Mr. Rush's language to provide grants to trauma centers that will prevent further trauma center closures and downgrades by assisting the centers with uncompensated care costs, core mission services, emergency needs, and information technology. We've also included some language that Mr. Rush recommended to aid areas where trauma centers have already closed. Next, with regard to emergency care, the omnibus includes a provision recommended by Mr. Gordon to authorize the Emergency Care Coordination Center at HHS. This center will strengthen our efforts to promote federal, state, tribal, local, and private sector collaboration and support to enhance our nation's system of emergency medical care delivery. We've also included language authored by Chairman Waxman to create a demonstration program to strengthen ER capacity. And then we have dental emergency responder provisions. There are provisions in this amendment that Mr. Stupak has been working on to strengthen our emergency response system by including dentists in the federal definitions of public health worker and emergency response provider. Though dentists have gone through training in emergency care, they are rarely integrated into an emergency response plan, and this language will help remedy that situation. Next is with regard to pain care. We've included provisions from Ms. Kapp's bill on pain care research and awareness. Pain is the most common reason Americans access the healthcare system and is a leading cause of disability. It's also a major contributor to healthcare costs. The provisions in this amendment would address this public health problem by advancing research into the causes and treatments of pain and expanding outreach and education of health professionals. Next, with regard to postpartum depression, we've included language championed by Mr. Rush to encourage continued research and educational activities on postpartum conditions. Postpartum depression occurs after 10 to 15% of all deliveries, and the majority of patients suffer from this illness for more than 6 months. In this most severe form, postpartum psychosis, women may actually suffer from hallucinations and delusions that can put them and their babies at risk. Next is no child left unimmunized against influenza. The omnibus includes language spearheaded by Mr. Green and Mr. Murphy.
Does the gentleman wish an additional minute? His time has expired.
It's almost done. You might as well hear
Without objection, the gentleman will be given an additional minute.
This omnibus includes language spearheaded by Mr. Green and Mr. Murphy that will create a multi-state demonstration program designed to test the feasibility of using the nation's elementary and secondary schools as seasonal and pandemic vaccination centers. Children are at particularly high risk of complications from flu, and in fact, influenza is the leading cause of vaccine-preventable death among children in the U.S. Having immunization clinics in schools could help increase immunization rates among children, thus protecting them from this disease. Two more, menu labeling. We've included language that Ms. DeLauro and Mr. Matheson have been working on that will require restaurants to label the total calories of their items directly on menus and menu boards, and to provide more detailed nutritional information to customers upon request. Now we know why Mr. Matheson and Ms. DeLauro are so thin. This will help consumers make more informed decisions on what they are eating and help reduce obesity rates in the United States. And finally, wise women. The omnibus includes Ms. Kapp's language to reauthorize Wise Women, a community intervention program funded by the CDC, yes, Wise Women, that helps prevent heart disease and stroke by providing screenings and counseling for low-income women. Just 2 days ago, Secretary Sebelius heralded this program as a great example of a community-based prevention program. The Wise Women program has been proven to be cost-effective and will ensure the program can continue its good work. And finally, this omnibus includes a few minor technical corrections to the amendment and the nature of the substitute, Mr. Chairman. Thank you.
The gentleman's time has expired. Mr. Barton?
Mr. Chairman, I am not a speed reader, but I can read, and I have tried to scan every page of this 70-some-odd page amendment, 75-page. There are some good things in here. There are also some things that in and of themselves would be entire bills. The very first one, this section 3201, the community living, that appears to be a brand new long-term health care program. It's not paid for. One of the provisions here on food labeling in restaurants appears to be a national preemption of state labeling laws for restaurants. It appears, I have to say. I'm not just saying that it is. Given the fact the majority has had all year to put their bill together, and right out of the box, their first amendment, it is a 75-page omnibus, excuse me. I'm going to oppose it, reserving the right later in the markup, if we defeat this, to come back and some of the things put back in on a case-by-case basis.
Would the gentleman yield?
Sure.
I just wanted to point out with regard to the Class Act, because you mentioned about the pay-for, it says that the statute or that Class Act would not go into effect until a voluntary payroll deduction under the IRS code is authorized. So it's totally paid for with a voluntary payroll deduction that the Secretary would have to put forward. Otherwise, we wouldn't put it into effect. It's a voluntary program paid for that way.
Well, I thank the gentleman. I didn't see that, but I didn't read the amendment word for word, but I appreciate his illumination on that point.
If the gentleman would yield to me.
Sure.
We did make this amendment available to your staff last night. I understand your concern. This is a piece of legislation that's moving forward, and some of these things I believe have been non-controversial, and people have been wanting to do it for some time.
I won't disagree that there are some things in here that are non-controversial.
But we've got a vote pending on the House floor, so let's break for the votes and come back immediately afterwards, and we'll talk further if members desire, and proceed to further consideration of this pending amendment. So we stand in recess until the last vote of the series that's pending on the House floor.